In today's lecture, we are going to learn about physiology of hearing. All the physiology involved in hearing. So let's start. Okay, everybody, ready? I'm starting. Now, the purpose of hearing in human life, the importance of hearing for humans, the first and the foremost importance is the communication. It is needed for the communication. Human being has developed speech and language, unlike other animals. So it is very much important for communications. Essential to the language, and on the purpose of hearing is localization of sounds. For different purposes, we need localization of sounds to determine the location of unseen sound sources, those sounds of threats, sounds of any imminent danger, and for animals, for the predators also, and for the prey, for the survival. This is very important for the protection. Now this is the overall picture of physiology of hearing, how we hear. All external, middle and inner ear are involved, along with the central pathways and even the brain. These all are involved in hearing. Now, hearing is not that simple as you think, as how we feel. It is a very complex mechanism and physiology. We can compare hearing with this picture. In this picture, this is a person with two small canals coming out of the leg, and he has nailed two papers, thin papers on the small canals, which is attached to the pond. And just by seeing the movements of these two papers, which is equivalent to human ear, he has to localize the position of the boat. He has to know this is a boat, this is a person, this is the fish swimming. He has to calculate all these things by only seeing these two papers. So this is a very complex mechanism. Hearing is a complex mechanism. So let's start. Ingredients for normal hearing. What do we need for normal hearing? First, we need stimulus, acoustic stimulus, adequate stimuli. It should be adequate so we can hear. Another thing is this stimulus should be conducted to our sensory organs of hearing, that is cochlea. Stimulus, then the conduction of the stimulus to the sensory organs, then the sensory transduction of the stimulus at the organs of hearing. Cochlea should convert this sound energy to the electrical impulses. This is called transduction, sensory transduction. Then neural transmission through the nerves, eighth nerve, cochlear nerve. These electrical impulses should pass through the cochlear nerve. So neural transmission of the signal, electrical signal, and the central auditory processing of the signal at the brain. And the brain should interpret these signals, central auditory processing. So these things are required for normal hearing. Now sound. What is sound? Sound is a mechanical wave produced by a source, vibrating source. This is generated by vibrating air molecules. There should be a media or the molecules of anything, air, gas, or solid, for the generation of and the transmission of the sound waves. Sound waves cannot be transmitted through vacuum. Here the bell is the source of the vibrating air molecules. Here the dog barking. This is the sound produced, sound waves generated. Now sound waves. Sound are waves, mechanical waves, which need media to travel through. These waves are alternating compression in the rarefaction of the molecules of the medium, which generates the sound waves. In this picture, this is the alternate compression and the rarefaction of the molecules of the wave. The molecules do not move itself, but they generate wave which moves along the direction of the sound wave. The molecules, they vibrate along the baseline, generating the compression and the rarefaction. Now sound wave is simple sound or a pure tone. It's called pure tone. It's described by a sinusoidal wave. The wave, there is a fluctuation from the baseline. There is the positive and the negative fluctuation. This is the condensation. The negative one is rarefaction. There are two peaks, troughs. The distance between the time period. This is the simple sinusoidal wave which explains the pure tone of the sound. It has got amplitude and the time period and hence the frequency. Now the properties of sound. In this picture about Gulliver, here the Gullivers, let's talk about the Gulliver's property. How tall is Gulliver? In the land of giants, he is very tiny, but in the Lilliput, he is himself the giant. Here the height of the Gulliver doesn't change. He must be around 5'12", so that doesn't change. That is the inherent quality of the Gulliver, the height. But when you compare to outside, then he might be a dwarf or he might be a giant. So similarly, sound has also its inherent properties and the perceptive properties. So properties of sound and what our ears detect. The physical dimension are the inherent properties of sound, and the perceptual dimension are how we perceive those inherent qualities or the dimension of the sound, physical dimension of the sound. So the physical dimension of the sound is intensity, frequency, and the complexity. This intensity we perceive it as loudness, and frequency we perceive as pitch, and the complexity we perceive as timbre. This is a high frequency sound seen by the wave. This is the low frequency sound. There are two sound with the same frequencies but different amplitude, means they are different in intensity. This is high intensity sound. This is low intensity sound, but with the same frequency. This sound, we hear it louder because it is more intense, and we hear it softer. Similarly, the pitch and the frequency, this another dimension of the sound. And the complexity, the simplicity and the complexity. This is a complex sound we perceive as the timbre. Now, low frequency tones around 300 Hz tone, 300 cycles of waves per second, 300 Hz tone is seen like this. High frequency tones, 3000 Hz tone is seen like this. Tones may be of different amplitudes, but they are of same frequency. These two sounds, pure tones, this has low intensity, this has high intensity, but they are of same frequency. Now, frequency of sound, we perceive it as a pitch. So high frequency sound, we perceive it as a high pitch. Low frequency sound, we perceive it as a low pitch. The male voice has low frequency, that's how we perceive it as a low pitch. Female voice is a high pitch, high frequency. And another thing about the frequency of sound is the octave scale. Octave scale is nothing, it's just a multiple of a fundamental frequency. This is a multiple of the lowest frequency. So 500 Hz sound is octave of 250. Similarly, 1000 is the octave of 500. So just octave is the multiples, and these sounds, they sound similar. These octave sounds, they sound similar. Now the complexity of the sound. Now pure tone is a simple sound, periodical sound with a simple single frequency sound is pure tone. The tone we hear in our phone dial is the pure tone. It's a simple periodical regular sound of single frequency. Now the musical tone is the mixture of sound of different frequencies, but these frequencies, they are in harmony. The bigger frequencies, the higher frequencies are just multiple of the lowest frequency sound. The lowest frequency sound is fundamental frequency. So the other sounds are just multiple of these fundamental frequencies. That's why they are periodical and they are in harmony. This is the musical tone depicted in this waveform. Now, noise is non-periodical sound of no characteristic frequency. They are haphazard frequencies. They are not multiples of fundamental frequency, and they are not in a regular interval. And it produces noise, as seen in this picture. So, musical tone, pure tone. Now, the complexity is perceived as timbre. Complexity, we can see it in the waveform, the timbre, how we hear, how we can differentiate between different musical instruments, playing the same song, playing the same song, even the male and the female voice, we can differentiate it, singing the same song in the same similar pitch because of this complexity, which we perceive as timbre. So piano has different timbre, characteristic timbre, guitar has different timbre. So it is for us to perceive the different timbre. That is the complexity we perceive as timbre. Now, sensitivity of the ear to sound. Human ear is very sensitive to the sound. It has a very wide range of frequencies. Human ear can hear from 20 to 20,000 hertz frequency sounds. And the amplitudes, the intensity of sound from 0.0002 to 200 dyne per centimeter square. This is measured at the sound pressure level. This wide range of sound amplitudes or sound pressure level and this wide range of frequencies, human ear is very sensitive in these ranges. Dogs have even higher ranges. They can hear till 50,000 hertz, and bats even more. Now, another fineness of human ear is that it can detect the difference between two sounds occurring 10 microseconds apart in time. This is called temporal resolution of human ear. It can differentiate the two different sounds occurring between 10 microseconds, that quick. Now, the sound intensities. Now, about the sound intensity, which we perceive as the loudness. Loudness is the perceptual dimension, physical dimension is the intensity. So, in order to measure the intensity of the sound, we use this logarithmic scales called decibel scale. Now, the threshold of human ear, the faintest sound human ear can hear is 0.0002 dyne centimeter per centimeter square. This we have designated as 0 decibel. And the loudest sound which human ear can hear, 200 dyne per centimeter square, is 120 decibel. We have reduced this wide range for practical purpose to just 120 decibel units, from no sound to the maximum sound. So this 10 to the 6 power 6 units is reduced to only 120 units. This is the formula to calculate the sound pressure level in decibel. This is the 10 times the logarithmic scale of this pressure of sound, and this P naught is the reference sound pressure level in pascals. This is a complex formula for logarithmic scales, decibels. So seen in this flow chart, this is just an example. If we increase the intensity of the sound by 10,000, then on the base, if we do not use the decibels, then it will be around 10 to the power 4. If we convert this into the decibel, this is the 40 decibel. And why not bells? Just not why decibels? This is also for the convenient purpose. So if we increase this, then from 40 we can increase it to 41 decibel. If we calculate this in bell, it will be just 4, and we will be forced to use 4.1. This is just for practical purpose and for easiness. Logarithmic scale of decibel is used to measure the sound pressure level or the intensity of the sound, which we perceive as loudness. So intensity of various sounds, these are the examples. Rustling of leaves, the faint sound is 10 decibel, whisper is 30 decibel, office noise 45, conversation is in 60, auto traffic 80, and the concert is the upper limit 120, jet motor is 140 decibels, spacecraft launch is 180 decibels. So above the concert, jet motor, and spacecraft launch will cause discomfort to your ear. Now, auditory field, human auditory field. Shown in this graph, human ear is not equally sensitive to the all frequency ranges. Just here at 20,000 hertz, 20 hertz, the intensity has to be above 80 decibels so that we can hear. Around 1000 hertz, it is very low, even 5 decibel or 10 decibel sound we can hear. So similarly, 20,000 hertz, again the range, the intensity has to be higher. Similarly, the limit also is the same thing. So human ear is not equally sensitive across frequency, all frequency ranges. Lower frequency ranges and the higher frequency ranges, the sound should be high in intensity so that we can perceive the sound. This is a conversational area from 500 to 3000 hertz is conversational area. Now, structure of human ear for the conduction of sound. This external ear, pinna, external auditory canal, tympanic membrane, middle ear ossicles, and the inner ear. Now the conduction, the role of the external ear, the pinna, it acts like a funnel to collect the sound around coming through various sources. It funnels the sound to the EAC, and the vibration passes down the EAC, and then it strikes and vibrates the tympanic membrane. Now the vibration tympanic membrane, where the handle of malleus is embedded, the malleus moves, incus moves, stapes moves, and the stapes finally vibrates the oval window membrane, the stapes footplate. Now from the oval window membrane, the sound is transmitted to the inner ear. Now it has three compartments: scala vestibuli, scala tympani, and the scala in the middle, scala media. The oval window membrane is attached to the scala vestibuli, and when this the movement of perilymph in the scala vestibuli, it's connected to the scala tympani through a narrow opening called helicotroma at the apex of the cochlea. So in this cochlea and in between these two, scala media and the scala vestibuli and the scala tympani, in the scala media lies the organ of hearing called organ of Corti. Now external ear functions collecting sound waves, and external ear also amplifies the sound which has frequency from 2000 to 4000 hertz. This is the natural resonant frequency of EAC, just like the guitar, the body of the guitar, it amplifies the sound from 2000 to 4000 hertz via its natural resonant frequency. And also the function of pinna is it localizes the sound. The vertical localization of the sound, not the horizontal localization, but the vertical localization of sound is done by the pinna. Because of its peculiar shape, it can identify the sound source, whether it is from above or from the down below. Now again, middle ear functions, structure of the middle ear. There are three ossicles, three muscles, three nerves, station tubes. Now, middle ear functions as a transformer or the amplifier. Now the middle ear, the function of middle ear is it matches the low impedance of the sound which is generated by the tympanic membrane to the higher impedance of the inner ear fluids. So the force which travels from the ear and which is destined to move the fluid should be much greater. It should be amplified. This force should be amplified so that the air can move the fluid. So how does it do this? It focuses the force of the larger tympanic membrane diameter onto the smaller diameter of oval window. And this has got another mechanism is the lever gain, ossicular lever action. I'll explain. Okay. Now the diameter of the tympanic membrane is 21 times greater than the diameter of the oval window. This is through the principle of the hydraulics. This amplifies the sound waves, the force amplifies the force, and also by the lever action, the ossicular action. This is a first degree lever. The handle of malleus is longer than the handle of the incus, and the stapes, it is 1.3 times longer than the incus stapes. So these two gains totally it amplifies 27 to 30 decibel. The sound entering the oval window is amplified. Now sound processing in the inner ear. After the inner ear fluid is by the stapes foot plate, which the force which has been multiplied by the middle ear transformer mechanism, now it reaches the inner ear. Now the movement reaches the inner ear. The structure of inner ear, you have learned in last class: scala vestibuli, the upper compartment, the inferior compartment, the scala tympani, middle is the scala media, and here lies the organ of corti. There are hair cells, tectorial membrane. These hair cells rub against the tectorial membrane, they generate sound impulses. There are outer hair cells, inner hair cells. Now this is the picture of organ of corti. So outer hair cells. This is the basilar membrane. This is the tectorial membrane. These are the afferent axons. Now the function of inner ear. There are two functions, main functions of the inner ear. The first one is the mechanical frequency analyzer. What it does is it converts the complex sound into the simpler sounds, decompressing complex acoustic waveforms into simpler elements. This is the function of frequency analysis. According to the different frequencies, it just decompresses the complex sound with many frequencies into the many simpler sounds. Another function is the sensory transduction. It converts the mechanical waves in the movement of the inner ear fluids into the electrical impulses through the movement of hair cells, hairs in the hair cells. Now, frequency analysis in the inner ear, as this picture depicts, for the simplicity, we'll unroll the cochlea, we'll make it straight. This is the movement of the inner ear fluid through the stapes foot plate, through the oval window, and it activates according to the frequency of the sound, different frequencies in the complex sound. It activates the certain areas of this basilar membrane. So the hair cells in certain activated area of the basilar membrane will generate impulses. Now the vibrating basement membrane, it creates the traveling waves which peak on characteristic place on the basilar membrane according to the frequency of the stimulating sound. So there are three frequency sound in a complex sound, and those three frequencies will develop three peaks at three different locations of the basilar membrane, which will push the hair cells along the tectorial membrane, generating the electrical impulses from the hair cell at those particular areas. This is also called the place theory of hearing. Now, this is the tonotopical organization of the basilar membrane. In cochlea, we have the tonotopical organization. That means that each tone of a particular frequency has a particular activation area. The structure of the basilar membrane at the base of the cochlea, it's narrower. At the apex, it is broader. It's just opposite. This is the base. This is the apex. So the high frequency sounds will activate this narrower portion of the basilar membrane, which is located at the base of the cochlea. Higher frequency sound. The lower frequency sound, it activates the portion of the basilar membrane at the apex, which is broader. As seen in this figure, this high frequency 20,000 kilohertz, 20,000 hertz is activated at the base of the cochlea. This is the apex. Here the low frequency sound is detected. This is the tonotopical organization of the basilar membrane, or as a whole, tonotopical organization of the cochlea. So, inner ear acts as a multi-channel mechanical frequency analyzer. So 50 hertz at the apex, at the base 3000 hertz. So it acts as a complex multi-channel mechanical analyzer, frequency analyzer. So one function of the inner ear. The another function is the sensory transduction in the inner ear. The tectorial membrane picks up the sound pressure wave in the basilar membrane moves, it's rubbed against the tectorial membrane, and the sound is the sound waves, the movement in the inner ear fluid is converted into the electrical impulses, which is passed through the afferent nerve fibers. This is the sensory transduction function of inner ear. There's a release, this movement of this hair shares will release the neurotransmitter, and electrical impulses are generated. All these from the mechanical reaction to the chemical reaction, then the electrical impulses. Now, there are two kinds of hair cells, outer hair cells and the inner hair cells. These are afferent hair cells, mainly works as afferent fibers, and they synapse into the spiral ganglion cells just like any other sensory cells. Now they pass through the auditory nerve. Inner hair cells also has afferent function, but more than afferent, it has the efferent function. Now, role of the ear in hearing. Now all mechanical waves are generated into the electrical waves. The electrical waves pass through the nerves, and now finally the role of the ear, the sound we hear, we can interpret it only when it reaches our brain and it gets processed in the brain. So central auditory pathway is very much important to understand. It is the pathway from the cochlea, the sensory organs, once the electric impulses are generated, how it travels to the brain. Pathway from the cochlea to the cortex. And now these auditory nerves, they do not directly go to the brain. It synapses in series of subcortical structure. They have a series of stations where they synapse with other nerves. Now the first one is the cochlear nucleus. After the spiral ganglion, those nerves go and synapse in the cochlear nucleus, which is located in the medulla. And from the cochlear nucleus, fibers pass to the superior olivary nucleus. In mid-pons, here the fibers from the both sides, nerve fibers from the both ears, they synapse. And from there to nucleus of lateral lemniscus, which is located in the pons midbrain junction. And from there to inferior colliculus in the midbrain. Then medial geniculate nucleus in the thalamus, and finally to the auditory receiving area in the temporal lobe of the brain. This is the cortical auditory cortex, also called auditory cortex, area 1 in the temporal lobe. From cochlear nucleus, superior olivary nucleus, nucleus of lateral lemniscus, inferior colliculus, medial geniculate nucleus, and auditory receiving area, auditory cortex. This is the pathway. The mnemonics is ecolima. E is eighth nerve. From there, cochlear nucleus, from their superior olivary complex. This is the lateral lemniscus. This is inferior colliculus, and this is medial geniculate nucleus, and this is the auditory cortex. Ecolima is the mnemonics to remember this. Now central auditory processing. This the area 1 located in the temporal lobe is the primary auditory cortex. There are secondary auditory cortex in the temporal lobe also, which is related to the vernix area, and also this auditory cortex is related to the frontal lobe, into the vernix area, and to the auditory visual area, so that we can interpret the sounds we hear. And similarly, just like in cochlea or the basement membrane, there is also tonotopical mapping of central auditory, tonotopical mapping of brain. Even in this primary auditory cortex, we have specific areas dedicated for specific frequencies, just like in cochlea. So there is tonotopical organization in area 1 and areas 41 and 42. These are secondary auditory cortex. Now let's talk about binaural hearing. It's a hearing from both ear. How does it differentiate from monaural hearing? It's just like a 3D hearing, just like a 3D vision, monocular and binocular vision. We have the in the 3D vision, we have the depth perception. In binaural hearing also, we have the depth perception of the hearing, 3-dimensional hearing, and we can exactly pinpoint the location of the sound source. This is for the 3-dimensional localization of the sound. And this is because of this phenomena called binaural hearing. If the sound source is here, the single sound source, the both ear hears it, hear it differently. The one ear hear it faster, quicker. The another it hear it slower, and one ear which is nearer to the source will hear it louder. The another one farther away will hear it softer. So all these mechanism, all these differences in both ears is detected and processed by the brain to localize the sound, source of sound. So here the sound source is at the left side of this person. So the left ear will hear it louder and quicker, and the another ear will be hear it softer and the slower. And also the scatter sound, he will hear echoes, other objects from the other objects, and shadowing of the head also. It will get processed in the brain, and the brain will localize the sound source in 3 dimensions. While in vertical single dimension, the pinna help in localizing sound, but normal hearing of 2 ears is required to localize the sound. This binaural hearing, you can hear it in YouTube about virtual. There is a video called virtual haircut. You just put on earphones and you can feel it, the virtual haircut. That is that video, that sound processor processing in that video is synthesized using the this principle of binaural hearing. You can try that. It's very interesting. Now this is all about today's class. Then there are some assessment questions. Whisper is 30, 60, 80, 120. Whisper is 30 decibel. 60 decibel is normal talking. 80 decibel is shouting. When you shout, it's 80 decibel. 120 is the upper limit. That is the rock concert. Now, tonotopical mapping is present in cochlea, primary auditory cortex, both non. It's present in both cochlea and primary auditory cortex. Guitar and violin playing the same note differs in frequency, timbre, intensity, loudness. It differs in timbre. Now, which is not the perceptual dimension of the sound? Loudness, pitch, timbre, frequency. Frequency is not the perceptual dimension. Frequency is the inherent quality. It's a physical dimension. Timbre is the perceptual, pitch is a perceptual, loudness is a perceptual. The counterpart of loudness, physical dimension. Intensity, pitch is frequency, and the timbre is the counterpart. The physical dimension of timbre is the complexity. Now, middle ear does not act as transformer, amplifier, resonator, transducer. Middle ear acts as everything except transducer. It transforms the sound, it amplifies the sound, it resonates the sound, but it does not convert the mechanical energy to the electrical impulses. That is the work of inner ear. High frequency sound stimulates apical region of cochlea, mid region of basilar membrane, narrowest part of basilar membrane, broadest part of the basilar membrane. High frequency sound stimulates the base of cochlea where the basilar membrane is narrowest. That is the narrowest part of basilar membrane. Apical region has the broadest part of basilar membrane, which detects the low frequency sounds. Now, frequency analysis is done by ossicles, cochlea, cochlear nerve, cochlear nucleus. The cochlea has 2 functions. One is frequency analyzer, and is the electrical transducer. Now, I'll take questions. Thank you everyone for wishes for Guru Purnima. Logarithmic wala bujhe na. Logarithmic scale is just for the simplification. You need not know much about it. It is just for the simplification. We have very wide range for the loudness. The sound we measure intensity is in the sound pressure level, dynes per centimeter square. 20,000 kilohertz banda higher sound nasumne region. Human ears are made like that the pinna, the shape of the pinna, the movements of the pinna, it will will restrict to us to hear the high frequency sound. Just like in animals like bats and dogs, they have large pinna and they can direct the pinna with different kind of muscles, around 20 muscles. They have around 20 muscles in EAC to move their direct their pinna towards the sound source. That's why they can collect more sound and they can hear the more high frequency sounds. This is the reason for the limitation. And everyday sound is 20,000 hertz is too much a range, 20 to 20,000 hertz for humans. Impedance matching. Impedance matching is just a thing that we have just, you need to blow, you need to move a fluid. You need to move a fluid just by moving the air. It's so hard to blow a fluid, okay, than to blow away the smoke. So there is the high impedance, fluid has a high impedance or the resistance, air has less. From the air we have to move the fluid, so the force in the air we should multiply it, we should transform it. So this is the impedance matching. So this is done by the middle ear, from the tympanic membrane to the oval window area gain and the lever gain. It is multiplied, 27 decibels is increased, the force is increased. So this is the impedance matching. It matches the impedance with the inner ear fluid, so it can move the inner ear fluid. Otherwise it is very difficult to move the fluid by the air. The sound waves are just the vibration of air molecules. It has to move the fluid in the inner ear fluid, inner ear. So why decibels, not bells? Because when we use bells it will be less. When we use conventional it would be something like 10 to the power 6. So we converted into the, we just decrease that range to the 0 to 120 decibels. So if we convert it into the bells, it will be 0 to 12 bells. That will be too narrow range. So when we describe the changes of different intensity sounds, so we need to do 1.2 decibel, 12.9 decibel. So instead of not 12, 10.9 decibel. So instead of that, for the simplicity purpose, we converted it into decibel. Role of round window in mechanism of hearing. Okay, round window has a very very important role. So when you push a fluid from the oval window, there should be an outlet. There should be an outlet so that the fluid can move. If the round window is rigid, so we cannot move a fluid in a closed container, closed and the fixed container. So round window is very much important to let go the movement of the inner ear fluid from the oval window through the tympani, scala tympani. The fluid in the scala vestibuli will move through the helicotrema. It will move to the scala tympani and it will push the round window membrane outside. If the round window membrane is rigid, then there is no movement of inner ear fluid. And another importance of round window is in the hearing is for the phase difference. The round window is located in such a position related with the oval window. It is not in the same vertical plane. It is a little bit anterior to the oval window. Sorry, yes, a little bit anterior to the oval window, so that the waveform, the wavefront does not strike the round window and the oval window together. The certain part of the front part